Good afternoon, everyone, and welcome to ACU's STAR Center Burnout webinar series. We are so excited to have you on the line with us as we dive in to the first of this 5-part series. Today, we will be defining and identifying burnout in your organization. So for those of you who aren't familiar with ACU, we are the Association of Clinicians for the Underserved, and we are a national nonprofit membership organization focusing on getting clinicians into underserved areas. And our STAR Center is our national cooperative agreement and our NCA. And STAR Center stands for Solutions, Training, and Assistance for Recruitment and Retention. And with that NCA, our STAR Center develops and disseminates training and technical assistance in regards to recruitment and retention. And we are excited to be talking about something that is near and dear to I'm sure, many of the hearts of the folks that are on this call today, burnout. My name is Suzanne Spear, and I'm the Director of Workforce Development here at ACU. And today I'm joined by Mariah Blake, who is our Program Manager. Just a few housekeeping items as we begin our webinar today. First, we are recording, and this recording will be emailed to you at the completion of this call, along with the slides. If you would like to access a copy of the slides prior to that, they're located in the handout section of the Go-To toolbar on the right of your screen. Feel free to ask questions as we go along, and let's have a little fun, why don't we? If you do have questions during the session today, you can use the raise your hand tool in the control bar on the right of your screen to alert our team that you have a question. And you can either use the chat or questions box in the control bar to send a question to us. And then at the end, we will direct it to the presenter for an answer. If you think of a question after this broadcast, or would you like follow-up information on anything presented here, feel free to email Mariah Blake at mblake@clinicians.org, and she will get you pointed in the right direction. We are absolutely thrilled to have Lisa Hardmeyer-Gray with us today, and she is going to be leading us in this 5-part series. She's the founder of Intrinsic, a consulting company offering training geared towards employee wellness, particularly in the healthcare field. She works with individuals to build stress management and resiliency skills, and consults with organizations on overall health and wellness, guiding them to become employers of choice. She is a certified instructor of mindfulness-based stress reduction through the Center for Mindfulness at the University of Massachusetts Medical Center. She is also a behavioral health provider at HealthPoint, a federally qualified health center in Seattle, Washington. So without further ado, I'm going to hand it over to her. Lisa, take it away.
Okay, thank you, Suzanne, and thank you, Mariah, for all your work setting up this webinar. As Suzanne said, this is a topic that's near and dear to your hearts, also near and dear to my heart. Just to give you a little bit of background, as Suzanne mentioned, I came to this topic through my training and developing projects for working with veterans on PTSD treatment, patients in community organizations, in wellness centers, with organizations developing their wellness plans, all teaching mindfulness-based stress reduction. And I went to a conference, a mindfulness conference, and someone was presenting research project on mindfulness for physician burnout. I was pretty moved by what I saw, and then coincidentally came back to Seattle and was asked to teach several mindfulness-based stress reduction series for physicians. At the same time, I was doing my graduate work to become a behavioral health person or provider, and for the last 3 years have been actually working full-time as a behavioral health provider in a health center. So the topic of burnout, I think I see it through a different lens at this point, one that's maybe a little closer to home. And the shift that I've seen, so the other part about me, I have a 20-year history being a documentary filmmaker. I worked on a lot of public television projects, including one of the Bill Nye series. So I come at this from a love of research and putting together a program that really hits all the marks and is comprehensive. So if I don't have all the answers for you, I hope during the course of the webinar to be able to draw other people in who have operationalized some of this, as well as just during the week finding out any additional questions you have. So the topic of burnout, what I've noticed in the last several years is definitely a shift from the negative correlation of burnout and even burnout prevention to something more along the joy of practice. I don't know who actually coined the phrase joy of practice, but there seems to be a movement that's kind of being captured by that term. And I'll draw off quite a few resources that I found and share them with you. But really there's a shift. And I felt this personally. I was teaching these physicians who were driving through rush hour after putting in a full day to take a class on mindfulness-based stress reduction. While I think it's phenomenal and I see the results, I was also struck that probably 50 years ago, these same physicians would be doing just fine in their practice, that it's the systems that needed to change as well. So I want this webinar to be comprehensive. Next slide, please. Looking at really how to define, identify burnout in your organization, how to implement concrete steps to change the organization, and then really changing the culture, the workflows, and then lastly, I want to touch on self-care. Not that I think self-care is least important, but I think my experience working with physicians has been a mixture of sadness that they're somehow not up to the challenge of their job, or resentment that they have to do yet one more thing to manage what is a kind of broken system. So I hope this whole overview really is kind of soup to nuts. We will dive in as deeply as we can. Especially in episodes 2, 3, and 4. So today, I don't have control of the, yes, thank you. So today we're going to look at understanding and identifying burnout in your staff and your organization, learning about the causes, how it's impacting not just the providers, but organizations, and then look at various assessment tools and start to talk about strategies to measure burnout, and then start introducing concepts of what a plan to not only deal with burnout, but to really become a place that is fostering this idea of the joy of practice. And I wanted to just share a quote. One of the resources that I'm leaning heavily on is from the Institute for Healthcare Improvement. I'll cite that later. And Don Berwick is the President Emeritus and Senior Fellow there. And I want to use his quote because this to me captures what we're all about. What we are in the healing professions and its support roles, what we in the healing professions and its support roles get to do every day touches the highest aspirations of a compassionate civilization. We have chosen a calling that invites people who are worried and suffering to share their stories and allow us to help. If any work ought to give spiritual satisfaction to the workers, this is it. Joy, not burnout, ought to rule the day. So with that in mind, I want to just, next slide please, I want to just find out the first poll question. In your organization, have you had previous training on identifying and preventing burnout? I just want to get just a snapshot of the level of training that people are already have had or have been exposed to. I recently did a workshop, and I think there were probably 70 or 80 people in the room, and I was really surprised that only 2 or 3 had had any training. And I know there's other organizations that are fully implementing some of the plans we're talking about, so it's a wide variety. Okay, so 76% have not had any training, 24% yes. So that's helpful for me to know how deeply to dive in here. Okay, so thank you for that. Next slide. So Tate Shanafelt is one of the lead researchers on burnout. This was from 2009. 1 out of every 3 physicians has experienced burnout at any given time. I'm going to have to ask for the slides to be, to ask for next slide. I don't have control. So more recently,
you can click. You can, sorry, Lisa, you can click on your screen and it should advance.
Okay, let's see. Yeah. Okay, there we go.
Great.
Okay, here we are. Thank you. So 2015 study found that over 50% of physicians report symptoms of burnout. And while this webinar really focuses on the research around physicians, it can be extended to many in the helping profession, nurses, nurse practitioners, behavioral health. So here is another statistic: 33% of new registered nurses seek another job within a year. And this is kind of breaking it down by specialty. And if you can kind of zoom in there, family medicine is really at the top with 60%, definitely on the rise. And you can look at some of the other buckets. Going down towards the bottom, psychiatry is almost at 50% as well. And let's just start by talking about what is burnout. Well, when we think of ourselves in this profession, I know for myself, it really started with a passion of, a spark, a flame that was lit to be wanting to impact and help people find treatments, methods, ways of thinking to improve their quality of life, their well-being. And, this image is perfect, that just for many reasons, which we'll get into, and for a lot of people, that flame, that spark, it dies. And one of the leading measures of burnout is the Maslach Burnout Inventory. This was developed in the 80s, looking at all industrial burnout. It's since really expanded and has become more, there's specific types of measurements within the Maslach Burnout Inventory that measure certain industry types. This is a measure that has license fees associated with it, but it is kind of the leading measure. I'm going to go into some other measures, but just to start defining and thinking about what burnout is, I want to draw on Maslach. It's characterized by 3 spheres, again, according to this inventory: emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. There's also a single measure that's actually a reliable substitute for the fee-based full burnout inventory. But just that feeling of emotionally burned out, emotionally depleted, becoming more callous towards people. And the single measure can actually be a good indicator for a level of burnout. And I'm going to go into the causes. Like I mentioned, physicians 50 years ago, 40 years ago, I know there's people who I talk to often in, in health centers who they just can't understand they almost see it as a lack of toughness. And I think really looking at the systems and how the systems have changed. And so these are, according to the American Medical Association, looking at the causes of burnout, loss of control over work, the massive increased performance measures, just the complexity, the electronic health records. You know, you all probably hear in your organizations, providers taking home computers, charting from home, spending more time documenting than they are actually face-to-face with their patients, which is the part of the practice that really gives them the deep meaning. And, you know, there were some quotes that, you know, I feel more like a typist than a MD. So also just overall profound inefficiencies in the practice environment. And all of this has altered workflows and increasingly changed patient interactions. So as I mentioned, these are some of the more contemporary changes. Some things that have always been here as a caregiver and as a provider are just compassion fatigue, secondary trauma that we are witness to and hear some of the deepest suffering there is, and how we work with that on a daily basis, how we shift from taking that home or not taking that home. These are all things that we'll consider throughout this series, but the cost and consequences of caring. Caregiver stress. We are really witness to some of the, you know, deepest suffering in our society. It's indirect, but interestingly enough, has very real physical and emotional manifestations. And these are some of the signs to be thinking about and looking for. And as you read this list, you might notice something that you feel in yourself. You might kind of be thinking about different people you might have seen in your organization. You might even check in with your body and just kind of notice, does this just bring along a sensation of sadness or anxiety, or what does it stir up within you? Because it's serious, and it's a difficult topic to really look into. I give these, you know, workshops, and I can just see the level of energy in the room just go down when we really get into kind of the signs and the impacts. So hang with me for a while. This isn't the most cheerful part of this, but I think getting into some of the solutions and rethinking how we're doing what we do. Okay, so the next question then is just, are you concerned that one or more provider in your organization is experiencing severe burnout? And when I say severe, I mean something that might really impact their functionality. And again, as you're answering the question, just you know, knowing that there are various levels. We'll talk about that a little more. Okay, so pretty high, 73% feeling like they are concerned, 27%. And what I want to say too about that is, you know, medical providers, you know, a lot of doctors, they're trained to be the caregivers and to, you know, really be the ones with the solutions and the answers. And I noticed this in the workshops I was giving when it was just a group of providers. The level of conversation and camaraderie they felt being just in a room of providers, and the conversation that came out. You know, they're not used to being to revealing weaknesses or vulnerabilities. That's not exactly what from my understanding, I didn't go to medical school. I went to psychology, but that training to be tough, and even the way residency programs are structured to just gut it through. This is kind of the mentality. And so you have to also wonder, in that 27%, are you really seeing, are people really showing what's going on? Something to think about. So moving on, besides burnout, this is some of the coping mechanisms and some of the impacts. An increased rise of substance abuse, disruptive behavior that can lead to mood disorders, and sadly, even suicide. This again is the citation is down below, an article called Taking Their Own Lives in the New England Journal of Medicine. 40% higher suicide rate for male doctors, 130% higher for female doctors than the general public. So the impacts are serious. They're serious to patients, society, institutions. It's causing early retirement. It's impacting a physician shortage, the cost of replacement, which we'll go into in a little bit. But I don't know the statistic offhand, but just the level of the drop-off of people really even wanting to go into primary care. And I'm sure you're all well aware of the difficulty in recruiting and retaining. But the increase of medical errors, malpractice, what is the impact to the patient when the provider is not on top of their game? What is the impact to their satisfaction? And then this currency of perception. If something happens in your organization and it ends up in a newspaper article in your community, what is that costing you in terms of how the community sees your organization? So it has vast and wide impacts. Impacting physicians, impacts patients, the institutions more broadly, healthcare delivery, families, and not to mention, just our ability to be creative and compassionate and find the sense of joy in life. So going back to that question about replacing, how much do you think it costs to the average cost of replacing a primary care physician? $40,000, $125,000, $180,000, or $250,000. And again, the emphasis here is on the physician, but you can know that this impact is more broad. Nurses, nurse practitioners, behavioral health, medical assistants. Yeah, so most of you are in the ballpark, 250,000. And that actually is a pretty conservative estimate. Other research and data suggests it's over 500,000, maybe up to 1 million. So thinking about your organization, how are you measuring burnout? Are you measuring burnout? This is another tool that I see being used quite a bit. It's being used in the health center where I am. It's free and available for use. It's a self-scoring tool, 30 questions, and then a deeper dive into compassion, satisfaction, burnout, secondary trauma. So this is something you might think about implementing But then you also have to have a plan for what are you going to do when you gather this data, who are you going to share it with, and what are you going to do about it? And we'll get into that later. I'll also talk about some other assessment tools, but I just want to get an idea, again, going to another polling question. Do you administer a burnout assessment tool in your organization? And it doesn't have to be any of the other ones we've talked about, but just want to get a general idea of, are you assessing for burnout? Yes, okay, no, interesting. Okay, this is really interesting. 8% are, 92% art. Okay, so as you think about, I want to just tell a little anecdote. Somebody came up to me after one of these sessions. She was a nurse. She was a mother with 2 kids, and she said she went to her supervisor and tried to have a conversation about how she was feeling. She was having a lot of chest pains, had done a pretty good workup for any cardiac issues, was feeling more depressed. Really, she was showing signs of burnout. And she went to her supervisor and didn't have a direct conversation, didn't really know how to have the conversation, but was trying to talk to her about the workload. And the supervisor suggested that the nurse talk to the 2 nurse practitioners who had been at the organization a little longer, and said, why don't you talk to them about what they do for self-care? And the other 2 nurse practitioners, because there was a different level of the way they structured the workforce, the nurse could not work anything but full-time. Both of the nurse practitioners could work 4 days a week. So in this case, one of the nurse practitioners was single, had no children. The other nurse practitioner had a stay-at-home wife who was very supportive and also worked 4 days. So this nurse felt that she couldn't really, her provider or her supervisor wasn't really understanding her or what she was trying to tell her. And actually she ended up leaving her job within a year. So I say that as a way of saying, when we're administering these tools, are we as leaders, as managers, as supervisors, open and receptive to understanding the signs, the symptoms, and really having a sense of compassion for our providers, that if they come and tell us this, that they're feeling safe and open to have these conversations. And that's something we'll get at later, is just kind of leadership and how to really rethink that piece of it. So if you haven't done any kind of assessment in your organization, these suggestions have been taken from the Institute for Healthcare Improvement list of assessments to consider. The ones I'm most familiar with and see used the most is the Mini-Z Burnout Survey and the ProQual, which I talked about earlier. And there really is no thorough indicator for providers or for managers and supervisors to really get a handle on burnout in their organization. And we're going to talk about that later on, that you really have to draw from the burnout inventories or burnout measurements, absenteeism rates, turnover rates, to really understand how it's being impacted or how it is showing up in your organization. So the white paper, again, from IHI, is a fabulous resource. And then, so if you assess, what do you do with that information? So the last polling question, does your organization have a plan to address burnout? What does your lead provider do if someone comes and talks to her about their feeling of exhaustion or just not feeling connected to their patients? Okay, so 19% no and 81%, or sorry, 19% do and 81% don't. So again, we're going to really dive into the organizational restructure and hopefully bring in some people who have operationalized some of this and can prioritize some of this. But as a minimum, starting to think about how to even gauge at a minimum the level of burnout and just having a basic plan. So this is taken from a really great resource by the AMA. They did a multiple level study, actually trademarked the name Joy in Medicine. So it's a document called Creating the Organizational Foundation for Joy in Medicine, and that's available. The website is right below, steps forward, if you want to draw on their research and massive resources to be able to compile this kind of information that's available free. But just to start thinking about, these are what they suggest as 7-step plan. So establishing wellness as a quality indicator. Now this is the larger plan, not just what do I do with this information, but starting a wellness committee and doing this wellness survey annually. Bringing together leaders and staff to discuss the data and then starting to think about interventions that promote wellness. And then onward within a year, repeating it, reevaluating it. But in the short term, really thinking about, there's a book that I didn't put the reference in called The Patient Comes Second. And a lot of effort is looking at the quadruple aim that we've been talking about, the triple aim for a long time, but the quadruple aim being clinician wellness. And I know at the organization where I work, they're shifting some of human resources to even calling it talent management, that instead of this kind of hierarchical structure of organizations are having to really be much more fluid and flexible and creating cultures of wellness, creating career development that all adds to this idea of joy and enhancement. So these are some of the things to think about. I'm just going to introduce a little bit of it this week, and then next week we're going to dive much more deeply into how to think about this in your organization and how to start implementing some small steps. And then looking at, this again is from the sources linked below, but thinking in terms of institutional, making clinician satisfaction and well-being quality indicators. And how do we think about maybe adding mindfulness and teamwork? How do we shift the way electronic health records are documented, managed, dealt with, the work conditions? How do we think about career development? And lastly, how do we think about self-care? So on the right-hand side, professional fulfillment is really in the middle with this culture of wellness, personal excuse me, going back, personal resilience, and then really changing the organizational structure, the efficiency of practice. So just to kind of recap, I'm hoping that you have a little bit of a better idea of what burnout looks like, how to think about measuring it in your organization, how to think about really having honest conversations. You know, how do we train our leaders and our managers to create safe environments for providers to let them know that, you know, I'm not doing so well, or I really need this to be addressed. The impacts both on personal lives, on the institutions, on the bottom line, really. You can make this a very economic argument, if you will, because the more we're taking care of our providers, the more we're impacting the bottom line. And then really starting to think about what is your plan going to be going forward. Again, just even if you do the basic of just measuring burnout and addressing any small shifts that can happen, but then really starting to think about how do we need to address this organizationally. And then just a little preview of next week. We're going to be looking a lot at what came out of this research project, In Search of Joy in Practice. And this looked at 23 high-functioning primary care practices. 2 of them are federally qualified health centers. So I'm trying to line up some people to come in who can talk about how to operationalize this, and specifically within a community health center, because there are definitely some striking differences, similarities, but I think that would be most helpful. And then looking again at some of the other resources, looking at the IHI, how they frame improving joy in work, what are the steps that they're recommending, and drawing on some other resources. So that is really it for week 1. Happy to take the remaining time. We have almost 40 minutes to answer any questions. And if you have questions that I can't answer, I'm very happy to work with Mariah and Suzanne to get those emailed to me and be able to have some answers to you directly, or if there are enough of the same questions, maybe bringing it up next week. So turning it back to you, Suzanne and Mariah, for questions. And thank you everyone for your attention and your effort, because this is such an important topic and can really impact the lives of those in our organization, and obviously to our patients as well.
Great, thank you, Lisa. I just want to remind everybody that the slides are available to download in your GoToWebinar platform right now in the control panel to the right of your screen. They'll also be emailed out to you following this webinar with a link to the recording of the presentation. So you can go back and listen again and look at the slides, so you can get kind of, I know some of the print got a little small there, getting all that great information on those slides. So we'll make sure we get those out to you. We did have a few questions come in, and we've got a good bit of time here. Also, if you have any questions, feel free to send them our way, and I'll read them out for Lisa here. The first one that I saw come in is burnout age dependent, or do all ages of folks experience that?
From my basic understanding, I think it affects all ages, and that's a good question. I'm willing to do a little more investigation, but my anecdotal answer, and just kind of giving these workshops and seeing who's there and what they're saying, I'm going to say it's across the board.
And what have you found is the role of clinic support staff in helping to address burnout?
I don't know if you can if you can give me more information, but what support staff are you talking about specifically?
If the person who fielded that question could pop that back into the questions box, we could follow up there. Medical assistants, nurses, etc. Support.
And you mean what is the role in them being supportive? Yeah. If I'm understanding the question correctly, it's my observation that everyone is feeling the same impact. So, you know, I think it's peer support. I think reaching out to, I guess what I'm hearing is that the support staff, can you draw up the support staff to help with the physicians? And I think that's going to come in the next episode when we really talk about team-based care, because there are different roles that MAs can work up to, different functions they can do in terms of the electronic health record, managing some of the orders, that there's more of a team-based approach. So I think that is really going to be covered in the next session, talking about, you know, pre-visit planning, pre-appointment testing, sharing the care among the team, bringing on scribes, assisting order entry. So I think there's a lot that can be done, and looking forward to diving into that next week.
Wonderful. Thank you for following up on that.
Mm-hmm.
We had a question. I think it also will be detailed a little bit further as we dive into the series here. But do you have a suggestion for kind of a questionnaire that they could, that our attendees could bring to their staff to assess whether people are experiencing burnout?
I think the two that come to the top of my mind that look like they're used quite often, again, is the ProQual, and that one there's a link to that on the slide, and that is free, self-assessment tool. And the other is the Mini Z, and that also is available and free.
And Lisa, this is Suzanne. I just wanted to jump in here and let everyone know that we here at the STAR Center are in the development of a burnout self-assessment tool. And so that should be available. We are hoping to have it online by the last one in the series. And so the STAR Center will have one as well. And again, that will be free too.
Thank you. Right.
Great. I just saw an interesting question come in here. What do you do, or what do you recommend that folks should do if they see burnout in a fellow employee? Is it appropriate to approach them directly or go to their supervisor?
I mean, you can, you know, if they're a friend, you can certainly just say, how are you doing? And suggest that they talk to their manager. But I think from an organizational standpoint, managers should be open to receiving this kind of information in a safe place where these conversations can happen. So I would encourage that person to really go and talk to their supervisor or their lead medical provider, and really have a conversation about this. There's, you know, some organizations have employee assistance programs where they can go and, you know, work with the therapist if they need to. Maybe there's the lead manager or the supervisor is understanding enough to create some time off. But I would hope that, you know, they feel safe enough to go to their manager, because it's really the organization that has to adjust and make room for them to do what it takes to heal, to recover, and then to be able to come back to work.
Wonderful. We had another question just come through asking if you could kind of dive into, I know we've talked a lot about provider burnout specifically, but burnout in senior leadership levels. Are there any differences there, different things to look for?
Well, I think one of the biggest difference, and you know, there's a lot of expert opinions on leadership, but I think one of the big differentiating factors is the compassion fatigue and the secondary trauma. That just compounds any of the other organizational impacts that are creating burnout. So it's kind of it's a little bit of a different issue, and I don't think we're going to address that as much in this series as we are just provider burnout. But it's certainly valid, it's certainly seen. I think there are a lot of similarities, and some of the restructuring. Yeah, and I'm happy to do a little bit of follow up on that too, and just see what supports might be there for that.
All right. Sure. Well, I've seen a few questions come through that all kind of speak to a desire for some more data about different burnout and different levels of staff. I know we're gonna start wrapping up the questions here pretty soon. I just leave it open for a couple of minutes for people to chime in if they still have any questions, and we'll plan to follow up by email with folks and hopefully bring some of these thoughts to the presentation next week.
Okay, and you said that they're similar in terms of does it cross different, is burnout similar with providers as it is with nurses or MAs? Is that the question?
Yeah, similarly.
Okay, yeah. And I think, yes, like I said, I think the data really focuses on the physician, but there's definitely data that supports burnout at all levels of the helping professions, social workers, nurses. And yeah, if you want links to that information or that data, I'm happy to provide that in a follow-up email.
All right, and we did just have one question come in asking just about the level of changes that can be made. So if an organization can only make minor changes, have you seen a case where a survey of staff would fuel more dissatisfaction because larger changes couldn't happen? Or is
that's
a small change helpful?
Yeah. That's a great point. There is to exactly to that point, that if you're not ready to implement a plan, if you're asking staff, what changes do you need to be made? What can we do to make this shift, or even start opening up the conversation, but you can't make any change, that's really going to lose trust, and I think it's going to have maybe a deeper impact. So I think that's something we're going to get into next week is, when you start addressing this, what level of change do you need to make to have an impact? What's the most minor change you can make? And what can you think about a long-term plan? Because you're absolutely right. If you start opening up the conversation, but there's no follow-through or follow-up, that can increase and exacerbate the problem and set up some distrust. I hope that answers your question.
And we had another question related to data come through. Are there any data sets on whether or how much burnout affects home versus personal life, or home life and personal life versus your professional life?
It's a good question. Yeah, I don't know if I know of any data offhand that separates it out. It seems like one impacts the other greatly, because some of the impacts, the mood disorders or substance use or depression, all impacts home life. So I'd love to get more clarification about what kind of data you're looking for, and happy to, again, provide that via email.
All right, yeah, just if anybody on the line does want to follow up, feel free to shoot me an email, Mariah Blake at mblake@clinicians.org. My email is in the chat box there and on the slides. If you just want to send me your questions, comments, thoughts, concerns, I'll get you directed in the hopefully correct direction so that we can follow up with you. Moving forward, we have, I think, an interesting question to end on here. Do you see a fundamental mismatch between provider expectations and perceptions of sustainability versus the demands and limitations inherent in the current healthcare environment?
Mm-hmm. The data that I've seen really suggests that when these changes are made, it can have a big impact and really can shift the level of work satisfaction. So I don't think it's and again, this is, you know, I'm happy to look into this more, but the data that I've seen that when these changes can be implemented, it really moves the dial. And again, that depends on, you know, each organization, what capacity they have to implement certain levels of changes. But I think the expectation should be that enough change can happen that providers really do find a renewed sense of joy in their work. And I think the data backs that up.
Great, thank you for that answer. It looks like we're winding down here, so I'm happy to give folks back some time on their calendars here. So thank you all very much for joining us, and thank you, Lisa, for your presentation today. I'm looking forward to diving a little bit deeper into this next week. I'll see you all back here next Thursday at the same time. Look for an email from the STAR Center with the recording of today's presentation and slides, and be sure to get in touch if you have any questions in the meantime.
Okay, and thank you everyone.
Thank you. Have a great day, everyone.